All right, good afternoon, everyone. It's Thursday, May 7th. I'm Rundy Murphy, epidemiologist and director of disease surveillance and environmental services here at the Mobile County Health Department. We're here to give you our daily update on the impact of COVID-19 pandemic on Mobile County. Worldwide, there have been 3.8 million cases of COVID-19 reported across the globe, with 264,000 deaths. In the United States, 1.2 million cases have been confirmed and reported, with 73,431 deaths. And in Alabama this morning, on the Alabama Department of Public Health live dashboard, they were reporting 8,699 confirmed cases of COVID-19 with 347 deaths. And this morning, our detailed report provided information on 1,331 Mobile County residents with confirmed or COVID-19 disease. 176 of those have been hospitalized sometime during their course, and 77 have died from COVID-19. A few other pieces of information that were made available today through our daily dashboard that our public information officer puts out. CDC has issued new information for school nutrition professionals and volunteers, also new information for people with pets, new information for testing and responding to COVID-19 in nursing homes. Across the U.S., this is a pretty dire situation of outbreaks that are occurring in nursing homes, and so there's been a sort of a tightening and refining of those recommendations from CDC. Don't forget that the Unified Command has created a map of testing sites for COVID-19 in Mobile. You can find that on our website. We can probably put a link to it in the Facebook chatter associated with this live feed later. But again, check with those sites. There are sometimes some restrictions or guidelines for who can be tested, but again, you can find that on our website. Let's see, a little bit more information perhaps on our 1,331 COVID disease patients. Again, most of them are between the ages of 25 and 64, but 25% are 65 or older. 60% female, 44% African American. And then we have, when you look at the zip code distribution, it's where we would expect it to be. We have more cases in the zip codes that are more densely populated and where known outbreaks are occurring at this time. We know that about 15% of our cases are healthcare workers. About 21% were either residents or employees of a long-term care facility, and about 27% of those 1,333 have recovered from their illness. So a little bit more about the hospitalized patients. This again is new information that we began providing daily earlier this week. So about let's see, looks like 90% of the folks who are hospitalized, so of the 173%, 90% of those are 50 or older. They're mostly women, but it's only 52% female and 48% male, so fairly even split. We still are seeing a disproportionate amount of African Americans with COVID who are hospitalized. It's at 58.5%, which is about 20% higher than the number of African Americans we have living in Mobile County. And of those that are hospitalized, about 44% have intensive care at some point during their hospital stay, and 25% of those require mechanical ventilation. And we know that these, we look at these as indicators for severe complications and bad outcomes. So that's why we're sharing with you what the profile of the folks who are hospitalized looked like, because we want you to understand that if you're in these risk groups, over 50, African American, underlying health conditions, please, please, please take your illness very seriously and seek treatment early for severe complications. So again, it's not that the virus necessarily attacks one race more than the other or one age more than the other. It's that when you are infected, we know that there are disparities with regard to age and gender and sex and race. So those that died, again, 99% of them are 50 and over, mostly male, 56%. Again, mostly African American, just over half. And among those who died, 87% were hospitalized at the time of death. And we know we've had a few die who were in residents of long-term care facilities. 96% of them were known to have underlying medical conditions. And about 43% of them were associated with a long-term care facility. So again, just take those pieces of information as power to help you protect those around you and in your family that are at greatest risk for severe complications, hospitalization, and deaths. All right. So that's, it's always tough to talk about, our residents that are suffering the worst from our COVID outbreak in Mobile County. But just to give you a little bit of perspective that, it's a really tough time out there, and we know lots of people are having, complications and deaths. But when we look at how we fare with other states in the Southeast, so we calculate what's called a population rate, and this basically identifies the number of cases that are happening per 100 population. So we can compare state to state then by sort of adjusting for the size of our population. So when we do that and look at the Southeast states, Alabama right now actually has the lowest number of confirmed cases among the Southeastern U.S. So although we haven't yet reached the White House goal for phase 1 re-entry, our conservative public health measures and community mitigation measures and things that we have done that we know have made it difficult for our residents out there, we strongly believe that they're working and that they're saving lives. So in Alabama, our rate of cases per 100,000 is 170. So again, Florida is at 173, Georgia 277, Louisiana 638, Mississippi 274, and Tennessee 200. So among those, our southeastern neighbors, at least by comparison, we have the lowest population rate of COVID-19 disease. And because of that, our leaders, will be considering when or if there can be a further lifting of the restrictions. And the current stay-at-home order is effective through May 15th, which is just next week. So we should hear soon about any changes going forward starting the 16th of May. All right, so on to a couple of questions. Seems like you guys never run out of questions. So I'll do my best to answer most of them. So we had several from the media today. Someone was asking, following up on something that was mentioned in the press conference yesterday, that the health department mentioned that we are not close to meeting the White House standards for reopening, and just asking for a little bit more information on that. So if you have, Googled White House reopening gates, that's what they're calling them, gates. So there are 3 gates that we have to satisfy before proceeding to a phased comeback. And again, this is outlined in the president's plan. One of the gates has to do with symptoms. So it is a downward trajectory of influenza-like illness over a 14-day period, a downward trajectory of COVID-like cases reported in 14 over a 14-day period. Then one of the gates has to do with cases, downward trajectory of documented cases within 14 days, or a downward trajectory of positive tests as a percent of total tests. And then a hospital gate, which means hospitals can treat all patients without crisis care, and they have a robust program in place for at-risk healthcare workers. And those are the three gates that we are following closely according to the president's plan. And again, if you look at our trends, we are nowhere close having a 14-day downward trajectory of anything. So we are still in the slightly increasing trajectory, and we know that slight flattening of the curve is because of these very important public health measures that have been put into place. And as those begin to be lifted or loosened, we'll continue to keep an eye on those trends. Another part of that question was about Mobile County lagging behind other counties in reopening. And really that just has to do with the fact that, Mobile County lagged behind Jefferson County in the early part of this outbreak. So in general, we were in the game a little bit later than some of our counterparts, and we'll be keeping a close eye on that. Of course, we have surpassed Jefferson County in the number of positive cases and the number of deaths, but the worst may not be over for us. And so where you may see regions of the state that have slowed down more quickly than we have, they may be able to lift restrictions where it's not going to be a whole state at once, potentially. There are differences. I think that you'll hear the governor say that Mobile is not like trustful. So there will be some differences potentially geographically. All right, the next question was asking me to speak to the effectiveness of microbe shield sprays that claim to eliminate viruses and bacteria on surfaces for up to 30 days. So I cannot comment on those particular products, but what I can do is remind you that CDC recommends using an EPA criteria, meets the EPA criteria for use against the virus that causes COVID, which is called SARS-CoV-2. And the EPA has a list of disinfectants that they have felt that they feel have met the criteria for being appropriately used as a disinfectant from COVID. Now, some of the companies that make these microbe shield products, I did not find them in the list of hundreds and hundreds of products that are registered by FDA to be used against SARS-CoV-2, but you can go there and look yourself. It's called List N, Disinfectants for Use Against SARS-CoV-2, and that's at the official EPA website. All right, here are some questions from the media about, again, a comment from yesterday about decisions about future shutdowns or public health restrictions would be based on data at that time. Are there any specific indicators? And I think we just talked about that. Yes, there are some specific indicators that we look at, but we don't only look at those. So we are looking every day at the data from all kinds of angles and looking to see if we can glean information about the spread in our community. Here's something that says our data indicate that around 15% of cases are from long-term care facilities, and folks are still asking us to provide detailed information about if we can't say who they are, can we at least say how many cases they have and that sort of thing. And we don't do that because it's really not helpful. We are working with them. We have been consulting with our congregate settings for weeks on end now, talking with them sometimes every day, sometimes just every couple of days, depending on their situation. We feel like the measures are in place there to protect our community from spillover from any of these congregate settings. So, there is only employees are allowed to go in and out of those facilities. The community is not at risk for, transmission from the residents or inmates at detention centers. So that's why we just don't continue to focus on what's going on at those locations. Let's see. Can you explain why MCHD is not able to provide the number about available ventilators and beds? So again, this is information that is provided by the hospitals, and you can certainly reach out to them to see if they would provide that information to you. We're sometimes worried about misinterpretation of the data because, for example, until this week, there were no non-essential surgeries or procedures going on at hospitals, and so their bed count and their ICU count were very, very low. And in normal times, most of their beds are full. Hospitals make a living by keeping their beds full and staffing, only the number of beds that they need. So when the restriction to cancel all non-elective procedures, the percentage of beds that were filled went way down. And yes, now that it's opened back up, that they can do procedures and surgeries, the beds are starting to fill again as they, are taking in and conducting normal business. So it's a subtlety that we try to protect from getting misinterpreted. And the other part of that question is, do we share that information with other members of the Unified Command? And the answer to that is yes. We do share that information so that everyone that is making decisions under the Unified Command has some idea about how our hospitals are faring. The really good news is that the hospitals have been faring very well, and they have the capacity to begin, re-engaging their clients with, procedures and surgeries and diagnostics that they had previously had to eliminate. So that's the really good news, is that our hospitals so far have had plenty of capacity to handle the COVID disease that's happening, and that's one of the reasons why the governor and the state health officer was able to, lift that restriction on procedures and surgeries. All right, let's see. Okay, here are some of the Facebook comments. How many of the 44 on ventilators passed away? So at least just over 75% of those, but investigations are ongoing. So that's not a permanent number, but that's what we're seeing right now. Any new updates or guidelines for summer camps? I'm not sure who keeps asking this question, but remember that we are still under the Safer at Home order, and those restrictions have not changed, and they will not change, as far as we know, until May 15th. Someone asking about drugs that in the media and in social media have been reported as working to reduce severe complications of COVID disease and have some promise that they may be useful. And as clinical trials proceed and more evidence is collected, I'm certain that the FDA will make a recommendation about the use of those drugs when they feel that the benefit outweighs the harm that could be caused by using those inappropriately. So stay tuned for that. If you pass away from coronavirus, can your organs still be used if you're an organ donor? Right now, we're not recommending that laboratory diagnosed patients with COVID disease provide organ donation. That is out of a preponderance of caution, because we're not really sure at this point what harm might come from receiving an organ from a COVID positive patient. So right now the recommendation is that if you have died, or if you're a living organ donor, if you're COVID positive, if you're laboratory confirmed, the recommendation is that you not offer, donate or receive organs. How long is an asymptomatic person contagious? This is a little tricky. We know that CDC just changed the recommendations this week. Originally, they had said that someone who was asymptomatic, well, first they said someone who tested positive but was asymptomatic would need to stay at home for 10 days. And then they changed it to 7, and now it's back to 10, based on some data that they have and that's unpublished about viral shedding in people who are asymptomatic but test positive for COVID. So right now, anyone who is laboratory confirmed with COVID and is asymptomatic, they have to quarantine for 10 days. Let's see, some article. This is getting at, is there any hypothesis as to why the mortality rate in Mobile is higher than average? So our mortality rate, I think right now, is around 7.5%. And yes, that is slightly higher than expected. But again, remember that 43% of our deaths are associated with long-term care facilities. And we know we have outbreaks in many of these settings where, their residents are among the most highly vulnerable to COVID infection and complications and deaths. See, no one is getting tested because you have to be almost dead to get approved to be tested. Well, this is changing almost every day. Yes, the criteria for getting approved to be testing through the state laboratory just changed last night, and it gives incredible flexibility to local health officers and to providers. And basically, CDC has said this as well, that if you are in a minority group that has high risk of complications, if you are, if you work or live in a long-term care facility that has a case and you're asymptomatic, we can test you. The health officer can decide that you need a test. And I think next week you may see it open up any further. So please don't think that just because, a couple of weeks ago we were only testing those that were hospitalized or that had symptoms, that changes every couple of days. So keep checking with the testing locations if you think that you have been exposed to COVID and need to be tested. Let's see, someone let me know what RSV stood for. Thank you very much. Here is a question about taking outbreaks at nursing homes very seriously. We do take it very seriously. As I mentioned, we've been consulting with them intimately from the beginning about infection control, about the need to test, staying in touch with them to answer their questions, all day and night. We have done things like, donated personal protective equipment, donated cloth masks, donated cloth surgical gowns, taken test kits to them, showed them how to conduct the tests, helped line up the National Guard to disinfect. I mean, there are lots of ways that we have been taking it very seriously, and ways that we have been helping the nursing homes and the long-term care facilities and our detention center. But we generally, we do it quietly. We don't, talk loud and proud about it all the time, but we are very proud of the work that they are doing and of our partnership with them to contain the outbreaks in those facilities. So this is a repeat question as well. Why is it more probable to spread the virus in church or congregate setting than at a retail store? The difference is, in a retail store, you generally can have more space to spread out. If you're on a church pew, you're usually sitting a lot closer for a longer period of time. So that is the difference. You can get distance between you and somebody at the store, and generally you pass by them for just a few seconds if you need ketchup and they're on the ketchup aisle. But in a church or a congregate setting or a concert, you generally are sitting next to someone very close and for a long period of time, and that's why we worry more about transmission in those settings. Let's see. Why are children playgrounds open, and do you think it's safe? Well, again, some of the parks and beaches opened, but it's still, only be around your family. So if you are playing on play sets, just be mindful of washing hands and disinfecting and making sure that you are only interacting with your family unit. Let's see, looking for clarification on why Mobile County Health Department doesn't take more of the lead in testing at congregate settings. I think I've already addressed that. Yes, from the very beginning, even with the detention center, we have been speaking with them, making recommendations, taking test kits to them, donating PPE, all of those things. It's just that we don't need to brag about it because, we're all doing the job that we need to do to keep that outbreak contained. Let's see, a little bit about testing asymptomatic people. We are testing asymptomatic people in congregate settings. We're doing a lot of testing of asymptomatics of healthcare workers and of residents of long-term care facilities. And again, I believe you may see some opening of that next week. Also, if you're in a high-risk group and you're asymptomatic, like if you have underlying conditions or you're over 65 pretty much now, even if you're asymptomatic, you can get a test. So that is changing. And then one about someone's son who graduated from Michigan and wants to come back to Mobile, and yes, with some caution and physical distancing and those sorts of things, that should be totally okay. And I think that is it for today, and we're done. Okay. Yeah, I'm getting the sign to, get off the stage. So thank you again, and we'll talk to you tomorrow.